In the United States, we are significantly far down on the list when it comes to life expectancy and overall healthfulness, considering the money we put into our healthcare system. You don't have to just take my word for it. I'd encourage you to check out the link below, where you can learn more about the United States health rankings and other health-related data from the American Public Health Association website. Here's some information from the American Public Health website. The U.S. spends more on healthcare but has worse health outcomes than comparable countries around the globe. A 2014 Commonwealth Fund report for the fifth time in 10 years ranked the U.S. dead last against comparable countries. That was in measures such as quality of care, access to care, equity, and healthy lives. The Institute of Medicine looked deeply into U.S. health performance versus 16 of the most fairly comparable high-income countries. Their study found that people in the United States have shorter lives. Over the past 25 years, U.S. life expectancy has grown, but at a lower rate than in other countries. Bad birth outcomes. We have the highest rates of infant mortality, low birth weight, women dying due to complications of pregnancy and childbirth, and children less likely to live to age 5. Obesity and diabetes. For decades, the U.S. has had the highest obesity rate across all age groups, and American adults have high rates of diabetes. Disability. Older U.S. adults report a higher prevalence of arthritis and limits to their daily activities. I could go on, but I believe you get the idea. Look, I realize that this video may seem very negative, but I'm just presenting to you data, reputable data. So, with that in mind, there are indeed many things to be thankful for. I can tell you, as a registered nurse who has worked in a variety of roles in the conventional medical system, as well as someone who has worked in the holistic realm, that there is good work being done, and truly we have much to be thankful for. However, obviously we have some problems to deal with, as the data reveals, and then also go out and look around for yourself. Look at the health of the people around you. So there's really two main points I'd like to talk about. One is the actual acquiring of sound health information. The next point is the actual implementation of that information into our lives. So as we reflect upon our population's overall health status in our nation, it's important to recognize that it's actually become quite normal to be unhealthy. So if we are wanting to optimize our health to the end that we are in better health than what is considered normal, we must be willing to consider the actual information we're learning regarding our health, as well as the implementation of that information. So, as one goes down the wonderful road of health optimization, it becomes quite apparent that there will be plenty of times where you may find yourself standing out from those around you in terms of what you're learning and what you're doing on a day-to-day basis. In fact, you might start to actually feel a little weird. So let me really clarify that statement. What do I mean by weird? Well, first of all, I would propose that it's not weird to want to learn information and apply that information to your life in a way that's going to optimize your health. But you know what? If it's considered weird to some people, if you start doing those things that help you have more optimal health, by all means, be willing to be weird, because at this point, it has become quite normal to not be in good health. So we need to be willing to do certain things differently if we are wanting to experience more optimal health than what is considered normal for far too many people in the United States. So don't be afraid to stand out. Don't be afraid to do things that may be considered weird. Here are some examples. For example, we know that maintaining a physically active life is of fundamental importance when it comes to having optimal health. Of course, it's important to become educated to the end that you learn the information needed to have a physically active life based on your unique situation and goals, etc. Unfortunately, It's not too uncommon for people to become overly concerned about the minute details involved with physical activity. For example, one may not have their most optimal, fashionable, trendy workout attire available to them. People can also become overly concerned with the minute details of other factors related to physical activity, such as the time, the location, the type of activity, the people they're going to perform the activity around, etc. Regardless, the inability and or unwillingness to think outside of the box and to be flexible, maybe even be a little weird, could prevent us from overcoming barriers to live a more healthful, physically active lifestyle. Speaking of which, I wanted to show you a clip of a video where I actually talk about not sweating the small stuff, and I give a specific example to illustrate this point. So I want to show you something here. Look what I'm wearing. I've got this yellow hat. I have a black leather jacket. I have a brown hoodie. Black jeans. That's right, black jeans. So, this isn't the ideal workout gear for most people. Certainly not. Certainly not the most fashionable thing. But I'm not going to let that be an excuse. You know, at this point, I don't have any really ideal workout clothes available to me. So, you know, I have a choice right now. I could say, well, you know what, I don't have the ideal clothes, so I'll just wait till later. I'll skip that and maybe do that some other time. Or I can put on my black leather jacket and this and my yellow hat and just go out there and do it. So, I'm doing it. I'm gonna do it. So, I'm walking now, but I'm gonna be going on a jog, and I encourage you, as I would encourage myself, that if you are endeavoring to do something in your life on a consistent basis for good self-development, don't let the little things get in the way. Don't let these things get in the way. Don't sweat the small stuff. This is one of the reasons why I've been able to work out, to, you know, be more physically active on a more consistent basis now for years. Because I don't make these excuses based on these little obstacles. You just do it. You just do it. Or perhaps someone is eating out at a restaurant, or let's say with someone else at a grocery store, or perhaps at a dinner at a friend's house. It's important, even if it's considered weird, to make sure to communicate what you want to say clearly and effectively. So, let's use the following scenario as another example. Let's say you're out with some friends at a local restaurant to enjoy some lunch. Based on the conversations around you, you quickly realize that pretty much everybody in the group has a strong hankering for deep fried donuts and soda. The waiter goes around, and yes indeed, everybody is ordering deep fried donuts and soda. The waiter then comes to you. Are you willing to be outside of the norm of the people around you? Are you willing to respectfully and assertively voice your nutritional desires in this situation? If you're not wanting to eat deep fried donuts and soda because it doesn't adhere to your nutritional plan, there's nothing wrong with that, regardless if it's perceived as being weird by those around you. Next, let's consider the following scenario as another example. Let's say that based on your research, your education, your personal experience, that you believe in the power of quality nutritional supplementation. Let's say that you are on a quality medical nutrition regimen to optimize your health. Now let's say you're going about your day and you meet up with some friends of yours. Let's say all of them believe in the exact opposite. Let's say they totally disagree with you. They believe that nutritional supplementation is a waste of money, it's ineffective, etc. And yet you believe otherwise. Are you willing to stand out? Are you willing to speak up for what you believe in, even if it's perceived as weird by others around you? Alright, that about wraps up the video. I hope this video encourages you to do what it takes to live a healthier life, and I strongly believe that involves a willingness to think outside of the box, and to be willing to be perceived by some others as a little weird. Remember, it's become far too common in the United States to be unhealthy, so you need to be open to doing things differently if you want more optimal results than what is considered rather normal. So don't hesitate. If you have questions, reach out. I'd be glad to do what I can to support you to your prosperity and health. Take care.